Thank you for watching the Community Spotlight. I'm your host, Atia Harris. It's a pleasure to have you watching the program today. I have a wonderful guest in the studio. His name is Dr. Andrew Ball with CHS. So we're going to talk a lot about physical therapy today. Many people have aches and pains. They have constant body ache, and so we definitely want to make sure we have a solution and a remedy. Before we get into the remedy, we're going to talk a little bit about his background, how he came to this area, and just kind of get into what some of his niches are in this area of physical therapy. How are you doing today?
Good. Thank you for that wonderful introduction. To answer your question, I graduated Ithaca College in 1995. Decided at that point that I wanted to go into pediatrics. So I did a fellowship after that and came down to North Carolina to work for state government, and decided at some point that I wanted to work with adults, because in general little kids don't normally get my jokes, and I needed an adult captive audience. Made a switch into orthopedics and sports medicine as a physical therapist, and wanted to work with the best and the brightest. So I came to Carolina's healthcare system. They have a postdoctoral residency in orthopedics and sports, and they were building that, and there were folks that I wanted to work with. And I took a surreptitious route, completed a doctorate in physical therapy, PhD in healthcare management, and continued on learning advanced techniques in thrust manipulation for physical therapists and trigger point dry needling for physical therapists as well.
So what made you decide you wanted to switch to this area?
Specifically because of Carolina's healthcare system. Specifically because they were developing a postdoctoral residency program to train doctors of physical therapy to work specifically in bone and joint to sit for the board certification exam. There's only about 4% of physical therapists that have such a board certification. Most are simply licensed.
Okay, I'd like to go real fast and talk about some of the niche things that you offer.
Currently?
Yeah, currently to people that come to you for physical therapy.
Okay. Well, I see individuals from senior citizens who have had a joint replacement to professional athletes in the NFL, in NASCAR. My passion is with runners in particular. I do a fair amount of work with the Jamaican Olympic track and field team that trains right here in Charlotte at Johnson C. Smith University. So I work with those athletes, as well as the CIAA champion women's track and field team as well.
Okay, so do individuals or sports teams come to you before the injury or mainly after the injury? Because it sounds like you might be doing some stuff prior.
Yeah, initially, physical therapists are experts in human movement, and that can range from the movement of a joint, and oh, it hurts when I do this, or it hurts when I walk, or I'm having balance trouble, that kind of movement, all the way up to speeding reflexes for high-level performance athletes. And we see pretty much everything in between. Does that answer your question?
Yeah, that definitely answers my question. Let's talk about
how they came to us.
Okay,
I'm sorry.
fine.
Sorry to interrupt.
Go ahead.
So initially, I would see patients that came to me after injury. Since I've been doing trigger point dry needling, and because there were only, until very recently, there were only 3 of us here in Charlotte that did it, there are about to be another 22 that are fully certified at the highest, most advanced level. Because of that, I started to see patients that would come to me specifically for trigger point dry needling for sport performance.
Can you kind of explain what trigger point dry needling is? I'm pretty sure most people are not familiar with that terminology.
Yeah, the simplest explanation is that it is using a thin wire to massage inside of a muscle. You're familiar with a muscle knot?
Yes.
Right. Some of them are just a little bit too deep to get to with a massage.
Okay.
Or with what physical therapists call manual therapy, with our hands or with a tool.
Okay.
So if it's a little too deep, you have to use a tool to get a little bit deeper.
So how does this relate to acupuncture?
The simplest answer is that I'm a physical therapist, so that what I do is physical therapist. There are certainly acupuncturists that can learn trigger point dry needling. Some would like to have us believe that trigger point dry needling is an intuitive part of their education. I would question that. It's certainly not an intuitive part of a physical therapist's education. It's postdoctoral, postgraduate education. To that point, I have been involved in the training of several acupuncturists to do dry needling, and the reasons that they would stick a needle into somebody are different than the reasons that I would do dry needling.
Is this like a naturopathic technique? Everything
that I do is evidence-based. Everything that I do. I hold myself to that standard, as do most physical therapists. One of the differences between traditional acupuncture and traditional physical therapy is that physical therapy is founded on evidence and holding ourselves to what does the evidence say. Whereas in some other professions or paraprofessions, there is a tradition to what they do. It's as much art as it is science. And that's not to say that physical therapy is not state of the art, but it is also state of the science in a way that some other professions may not be to the same degree.
So what are some things that we're doing as a whole in everyday life that cause us to have to come see you?
For a physical therapist is an expert in movement. So if you're having trouble with movement, or you're having an ache and pain that is causing trouble with movement or the functioning of a particular joint, that's why you would want to come to see a doctor of physical therapy.
So if you're real athletic and you do a lot of athletic things, maybe if you ride bikes all the time, I mean, what are some habits that we're doing where we're going overboard and we're causing the strain?
Living. Yeah, I mean, there are individuals that will come and see me simply because they've torn a muscle or they've sprained a muscle and they have an ache there or an injury, a specific injury there. There are others that will come to me because they are really pushing themselves to get that little tenth of a second, which sounds like nothing if you're running a race, but that's the difference between first and last in many instances. So individuals would come and see me either after injury or for sport performance. Are you asking the difference between why someone would go and see an acupuncturist versus a physical therapist, or a chiropractor versus a physical therapist? Because I'm not sure I can answer that unless I'm the patient.
No, I think, like you said, everything that you do is evidence-based, and I know when you think of acupuncture, you more think of something on a naturopathic type thing.
Again, it depends on the individual acupuncturist. I don't want to throw acupuncturists or be seen to throw acupuncturists under the bus. There are several that I work with extremely well, and we trade patients all the time. Like I said, there's one who is learning dry needling who will be fully certified, and if all goes well for him, in less than a week here in the Charlotte area. So we work very, very well together, but what he is doing with his patients is beyond the scope of what a physical therapist would do, and his focus is on total body wellness. His focus is on some of the specific needling techniques that he can do are broader than the ones that I can do, and conversely, I utilize techniques in terms of thrust manipulation that he's not trained in. I do some exercises to help enhance the effects of what I'm doing that he is not necessarily trained in. So we work very well together. I would say that that many patients that I see for dry needling are future acupuncture patients in a lot of ways, because I have a pretty long waiting list, frankly, to get in and see me, and some of my folks just need what they call a quick tune-up.
Okay,
and so he's positioned himself really well.
Yeah, so obviously this is definitely working, especially since you have a waiting list on individuals to come see you. Want to know what are some of the top injuries, the most type of injuries that you see?
Me personally, or all physical therapists?
You personally.
Me personally, initially, I saw a lot of chronic pain. The physiatrist that I work with is one of those guys who all of his patients go in, they've seen 3 orthopods and 2 neurologists and 6 chiropractors and 5 physical therapists. Yeah, and he has a very unique ability. I'd love to plug him if that's okay. And he's not part of my system. He's just an excellent physician. Works up in Mooresville, and he spends more time with his patients than I've ever seen a physician spend. And a lot of times he's able to work with the patient doing his magic, and they don't ever need to see me. And then he kind of got to the point where he would send the majority of his patients to me for what I do first, and then he'd do his thing. And now we've kind of done this balance. So I see, I don't want to call them problem patients, but difficult to solve patients, puzzle patients, that the only reason they're seeing me is because something that they've done in the past with otherwise well-intentioned, good physicians, physical therapists, chiropractors, just hasn't worked. So it used to be that I would see your typical, I have a shoulder injury, I have a back injury, my ankle hurt, I sprained my ankle, and now I am seeing patients that have more chronic issues.
So what are like the causes of chronic pain? Is it pinched nerves?
It's a really difficult question.
Is it a broken bone that didn't heal back properly? Is it osteoporosis?
Yeah, I probably shouldn't have used the word chronic pain, but that's the word that most, that's the word that the layperson understands. In the literature, we don't really use that term anymore. It's more central sensitization. And I'll give you the nutshell version here. I'll compress maybe a 4-hour lecture, hopefully into a sentence or two. But people generally think of pain as an incoming situation. I step on a tack, right?
That's right.
And it hurts.
That's
and it hurts because the message goes from the foot, up the leg, up those nerves, to the spinal cord, to the brain, registered as pain. But there's always that lingering pain after you remove your foot, or if you burn your foot, there's that lingering pain. So something's happening in this feedback loop. Most of the patients that I see now are what's called centrally sensitized, which means they had an injury, okay? The injury's not there anymore, the tissue is healed, but something is still making them hurt.
Oh, wow. Is it possible the tissue healed incorrectly?
It is possible that that's the case. That's not normally the patient that I see. The patient that I normally see is, if you think of the central nervous system as a business, as a small business, you have your employees, which is the muscle, okay? You have your middle manager, which is the spinal cord, and then you have your CEO or owner, which is the brain. Put simply, something happens after the employees keep telling the middle manager, there's a problem, there's a problem, there's a problem, there's a problem, there's a problem.
When there may not be a problem.
Well, when there has been.
When there has been, but it's gone away.
Correct. So a well-intentioned physical therapist or physician will fix
miscommunication in the body.
Yeah. So you'll hear people say, "Oh, that pain's in your brain." And while it's true that you need a brain in order to process or feel that pain, often in cases that's otherwise called chronic pain, it's actually the middle manager. It's the spinal cord that is taking all of this information and gets not so much confused, gets allergic to pain, for lack of a better descriptor. There's a receptor in your spinal cord, and its job is to, it's called an NMDA receptor, and its job is to observe and report, like a mall security guard. No offense to any mall security guards, but their job is to determine, is that threatening, or is it interesting but not threatening? Okay. That receptor, its job is to detect pain or to detect vibration, pressure, sensation. Once it gets a little taste of those painful chemicals, it's like a 21-year-old who just had its first legal drink on a Friday night and just goes a little crazy. It's not interested in that vibration sense anymore. So it transforms from being a mall security guard to riot police, and all it's looking for is where's that pain coming from? Even if the pain or the riot has been squashed and put down. And the good news is that trigger point dry needling, if done correctly, is the only modality that I'm aware of where you can actually get a message through that faulty NMDA receptor in the spinal cord to the brain to tell it, look, we're cool down here, we're fine. Now the good news is the NMDA receptor, although once it becomes riot police, it never switches back. Your body turns those over once every 7 to 10 days. So a lot of people who have been in again, what would otherwise be considered chronic pain, can revert back to a pain minimized, if not completely pain-free state within 7 to 10 days. Doesn't always happen that way, but it's really powerful.
So how many treatments would they take of that to try to get
I want to be careful
point?
Here because I don't want anybody to quote me here.
We're not guaranteeing, but,
no,
but that's typically the results.
It's really fast. I have...
Wow. Is it like everyday treatment or 3 times a week?
No, I normally see patients, and it differs, but in general I see patients twice a week. It's different for different therapists, and I normally, I would used to, previously I would see a patient for 2, maybe 3 months at twice a week. Still doing some pretty advanced manual therapy care. I would say that my outcomes have improved according to, we use a computerized system to determine not only do you feel better, but are you able to move better? And I'm able to compare my scores to people across the country. And I would say that I'm able to get patients to a higher level of function with less pain in 25% of the time that I used to. And I used to think I was a pretty good therapist even then. So to answer your question, my mantra is normally better in 4 or schedule no more. That doesn't mean cured, but you should notice a dramatic difference within 4 treatment visits after the initial evaluation, or less within 4 visits. Usually, patients feel 50 to 80% better within the initial trial treatment. That's not, which doesn't even count in that 4.
This is a great therapy for chronic pain. I'm thinking about some of these individuals that play sports. Like, for example, I have an associate that's a retired NFL football player, and he's in pain all the time from playing football. And then you have other type of sports out there that are very strenuous for folks. And to think that there might be an opportunity for relief, what would you say to those individuals?
Send them my way, is what I'd say. Yeah, send them my way. Or to somebody with the letters CMTPT after their name. It stands for Certified Myofascial Trigger Point Therapist. There's a lot of different certifications out there for physical therapists, acupuncturists, chiropractors, physicians who want to learn how to do the trigger point dry needling. The CMTPT is by far, in my humble opinion, the most rigorous. It's about twice as long as any of the other programs and encompasses muscles that you wouldn't think to needle, frankly, in any other program. But anybody with that designation should be able to help them. It gets to, I think, what you were implying from your initial question about what kind of injuries I see. How do people get trigger points? They get them from really strong, hard contractions. So your linebackers that are slamming in to an offensive lineman, like being in a car accident, certainly would do it for your layperson. Falling will do it. Repetitive movements will do it. Pretty much, if you're using your muscle, you're going to develop a trigger point. The question is it one that is painful, and is it one that is referring that pain somewhere else? And that's really, I think, where individuals that are certified in myofascial trigger point dry needling can be really interesting in the clinical reasoning process and figuring out where that pain comes from. And before you get too confused, let me give you a quick example. Everybody understands that when a man, and women have slightly different patterns, but when a man is having a heart attack, the first thing they grab is their left shoulder, right? But that's not where their heart is. The heart is a muscle, okay? And it will refer that pain to other parts of the body. There are lots of muscles that will refer pain into areas that are often diagnosed or unfortunately misdiagnosed as other things. The classic examples are a knot back behind the shoulder blade. If you press on it, can give symptoms that are very, very similar to carpal tunnel syndrome. I do see patients that have had carpal tunnel surgery. And they may have had carpal tunnel problems. I don't know because I didn't see them at that point. But what I can say is the reason they think that the surgery, quote unquote, failed is because they never had the trigger point back in the back of their shoulder dealt with. There are individuals who will come in with what they think is a diagnosis of sciatica because the pain is running down their leg. And the first question I always ask is they always want to tell me how intense it is. And I try to politely, listen to that because it is important. And I don't want to discount somebody's pain, but what I'm really listening for is what kind of pain are you having? What does it feel like? And often they will, most of the time, they don't tell me it feels like numbness and tingling going down the back of my leg. When I hear that, I think this is probably true sciatica or a disc problem or something that falls more into traditional physical therapy. But most of them will tell me, no, it's down the side and it feels like an aching, cramping kind of thing. I've been to, tons of other professionals and no one's really been able to help me. That is a classic referral pattern for a muscle that's extremely deep in your hip. You stick a needle in that and it
massages.
It does. If you have a knot in that muscle, it can't contract normally, right? So people will come in with back pain and this kind of pain that goes down the leg. Sounds like sciatica, right? Okay. But if I put a needle into that muscle and I break up that trigger point, now the muscle is contracting normally, improves the strength of that muscle from what was maybe 50% lacking to normal. And I mean immediately. Immediately. I had that happen 3 times today.
That's absolutely great.
Immediately. The strength is normal.
Like, this is a miracle.
Yeah, and the pain goes away. And that's what I get. I've had patients cry tears of joy.
In the constant pain, and they finally get relief.
Yeah, and I feel, I feel relieved that they got the pain, but I got to say that I really feel bad for these patients that they went through life and through the healthcare system without anybody really diagnosing their pain. It's not really their fault, though, and it's frankly, unfortunately, not the fault of medical physicians or physical therapists or anybody else. Let me ask you this. A physician that specializes in the heart, what do you call them?
Cardiologist.
Yeah, and if they specialize in the eyes, what do you call them?
Optometrist.
Optometrist or ophthalmologist, right? Podiatrist, specialized. What do you call them if they focus on muscle?
A physical therapist.
Well, I'm not a medical physician, but yeah, I mean, your point is well taken. There's unfortunately not a medical champion, a medical physician or specialty that specializes in muscle. So it's left to either physical therapists that choose to specialize in that. Not everybody does. Physical medicine and rehabilitation physicians or physiatrists who choose to specialize in that, and not everybody does. But if you go to an orthopedic surgeon, they're going to specialize in bone and joint. You know that if you go to an eye doctor, they are not going to specialize in the foot, right? So it's really hard to find individuals that are
So you have a niche,
skilled.
basically. You have a niche market going on.
I do, but I don't think it should be. I think
that's why you have a waiting list.
It is why I have a waiting list. We're trying to deal with that.
So many referrals because you have so many successful clients and patients that have come through your particular practice.
We do.
My question is, if once someone goes through this type of treatment, are there any exercises they have to do when they go home, or what else goes along with the regimen?
Yeah. So physical therapy and restoring someone's movement function, in broad terms, is based on restoring the muscular system and joint system. So that's number one. You got to have free range in order to move, but you have to have the coordination to move through that new range. So that's phase 2. And then the last phase is the strengthening. So in my clinic, you may get a lot of these neat looking techniques first, right? But then it's a partnership at that point. And the philosophy of my profession is help the patient help themselves. And that's not the philosophy of every profession. But what we try to do is to get the movement first, passively. right? So I should be able to get the movement first. Then teach the patient how to move without compensation. And what I mean by that is if you raise your arm up in the air, a certain amount of movement at certain times it should happen at your shoulder joint proper. But there's also a fair amount of movement that should happen in a very sequenced way at your shoulder blade, at your ribs, at your waist when you're going to reach for something. And we focus on that. And if there's a problem, then we have to mobilize or manipulate that joint, and the whole process starts all over again. But to simply answer your question, because I think I've gotten a little off track, is the movement first, the control second, the strength third. So yes, of course, there's always exercises.
I'm thinking about individuals that get into car accidents. Oftentimes the first stop is the chiropractor, and some of what you do to me sounds like it's similar to what a chiropractor does as well. What's the difference?
I'd answer that question a couple of different ways. Historically, it's actually the other way around. You won't hear that because my profession hasn't done a great job, unfortunately, of teaching what the history of physical therapy is. But physical therapy actually didn't start during World War II. It started back in the late 1800s. And manipulation was actually co-opted by chiropractors. And the difference is that all chiropractors manipulate. Not all physical therapists do. So yeah, certainly there are patients that can go and be helped very, very well from a chiropractor. I'm often asked, you manipulate, you dry needle, how do you feel about chiropractors? How do you feel about acupuncturists? I have the same answer when people ask me how I feel about this PT or that PT. Which one? Which one are you talking about? There's good ones here in Charlotte, and there's not good ones here in Charlotte.
Okay, so how can someone identify that? Just bypass that and call you?
They can.
Or someone similar to you?
Or I would say that if you're not getting the results that you think that you should get within 4 visits.
Yeah, because I've heard some people say, hey, I went to a chiropractor and it worked. Some people say, hey,
for years.
It didn't work.
Yeah, for years.
It didn't work at all.
For years.
But a physical therapist such as yourself does similar things with evidence-based.
There's a lot of overlap in between professions, and what I would say the mark of a good clinician is knowing what your strengths are, knowing what your weaknesses are, referring when you're not helping a patient appropriately, and not wasting their time or their money. I have plenty of patients. I have plenty of patients.
You have a backlog
I do.
Of
I have plenty of patients. So it's not an issue of getting more patients into my clinic. It's, for me, my passion has always been, and I think I speak for most of the clinicians, regardless of their profession, that I hold in high regard, is all of us, our focus is how do we get the patient better as quickly and as inexpensively as possible. And if you get the feeling that that's not occurring, then you're with the wrong clinician.
Well, we appreciate you for coming here today. This is some great information to share with everyone watching the program, that if they're in chronic pain, there's some help out there. There's a lot of treatments out there.
If they're in pain at all, there's help for them.
This is something they need to try if they're in pain at all. We appreciate you guys for watching the Community Spotlight. Tune in next week, same time, same place.